We are live. Please continue.
Hello, good afternoon. Welcome to the live talk. I'm Dr. Mariam Zulfikar, OET mentor at MedExam Expert. I'm working as Senior House Officer in Obstetric and Gynecology in Health Service Executive in Republic of Ireland. And I'm happy to share that I have been a part of AIPPS in Ireland, and I would like to introduce to our lovely viewers that what actually is AIPPS. So AIPPS is Association of Irish Pakistani Physicians and Surgeons, and it is a registered organization for last 3 years here in Ireland, and it has done multiple achievements in the form of achieving equal rights for non-EU doctors and fast access to stamp 4, which is PR of Ireland in just 2 years, and then stamp 1H, which basically allows the spouse of a doctor to work in Ireland. And it has also done multiple fundraisings for doctors of Pakistan. And I'm also happy to share that in today's live talk, we are having our guest from AIPPS, who is Dr. Mozam Gulzar and Dr. Lika Rahman. Dr. Mozam Gulzar works as General Secretary of AIPPS, and Dr. Lika Rahman is the Vice President. So I would like to request Dr. Mozam to introduce himself. Welcome, Dr. Mozam.
Thank you so much, Dr. Mariam. It's lovely to be here with MedExam Expert and having you with us in AIPPS.
Yeah, I'm also glad to be a part of it.
Great. Thank you so much. I think Dr. Lika, he is on call today and there's been an emergency in his department and he's trying to sort that out. So he will join us as soon as possible.
Okay, that's fine. So, Dr. Mozam, if you can introduce yourself, that when did you graduated, and from how long you are working in Ireland, and on which scheme you are working. So please introduce yourself. Thank you.
Oh, yeah, sure. I graduated from War Medical College, Wakent, in 2014. And then after my house job, I started my FCPS Pediatrics in CMH and MH Rawalpindi with one of the best pediatrician in the country, best teachers and best persons, I would say. I still remember all of them and all the lovely nurses in the CMH department who treated us very well. I really regard them. So after that, I came to Ireland in 2018, and I started pursuing my career in pediatrics. Before 2020, I would mention, as you have already introduced about AIPPS, that there was only recent changes that equal training opportunities and STEM 4 and all those kind of stuff. So it only happened in late 2020 or early 2021. Before that, we were not able to allow for training in Ireland. So we just worked as standalone jobs in pediatrics and then did our membership UK and Ireland. And then recently I have switched my specialty from pediatrics to join a GP training program with ICGP, Irish College of General Practitioners. So at the moment I am second year of training.
Okay, thank you so much, Dr. Mozam, for your lovely introduction. And now I would like to request you, because we are having a talk today on career pathway to be a registered doctor here in Ireland. So we will start with the very beginning, that what actually is IMC, what is IMC registration, and how long does it take for any of the doctor to be registered with the IMC?
So I would say it's just like PMDC or AMC or any country. They have their own medical council and they want doctors to be registered with them before they can practice in their country. So Irish Medical Council, they have different type of registrations. I would start with. One is called General Division. Second one is Trainee Specialist Division. Third one is Observer, which I think none of us usually need to go with that. And then there's the Specialist Division, which is when you become consultant, then you register with that. The most commonly which is used by Pakistanis or accessed by Pakistanis is General Division, and only two third world countries, one Sudan and the other one is Pakistan, Ireland, have allowed their graduates, if they do as their house job in a particular criteria and their rotation of their house job are fulfilling the criteria of IMC, they can apply for IMC registration without any test. The
Mm-hmm.
test is called PRESS, pre-registration examination. So the PRESS, and there used to be, I would quickly talk about PRESS. There used to
Yeah.
be three parts of PRESS, 1, 2, 3. Now, to do PRESS 3, they have exempted PRESS 1 and 2, and for that we just need PLAB 1. So anyone who want to pursue that pathway to get IMC registration via PRESS, they need to do either PLAB 1 first or USMLE step 1 and 2, and then they get to the clinical part, PRESS 3, and then apply for IMC. The one which is used by us is they have to do house job in Pakistan with a particular rotational criteria, which is there should be minimum 3 months of general surgery and 3 months of general medicine in the mandatory rotations. And they can even do 6 months general medicine and 6 months general surgery. But
Mm-hmm.
now mostly departments, they are asking for subspecialties as well. So no subspecialty rotation should not be less than 2 months. So there
Okay.
are some hospitals in Pakistan which are offering like 1 month of dermatology, 2 months of psych, 1 month, 3 months of general surgery, general medicine. This won't work for Ireland. So either three months of general medicine and a subspecialty general surgery and a specialty of surgery, or 4 months of general medicine and a 2 months of specialty. So I hope I was able to convey this in simple
Yes.
words.
Yes. Thank you, Dr. Mozam. And here a question arises that I got to know that because when I was applying for IMC, there was nothing like my rotation was okay. But the thing is, most of the aspirants are asking that when they are applying for IMC, is there any specific rotation they are asking? Like you have to do in ops gynae, you have to do in general surgery, you have to do in anesthesia. So are there any specific extended fields in which you have to apply?
No, it's mandatory. Two ones are general surgery and general medicine, which is 3 months mandatory. It can be
Okay.
6 months each, but uh, mandatory are this. Either for obs gynae, some I remember some lady doctors in back home from our classmates, they did 6 months general medicine and 6 months obs gynae. So I think in
Mhm.
that situation, it would be difficult for them as they don't have general surgery in that. So if and in Pakistan, obs gynae is considered a specialty of surgery. So if you do
Yeah.
6 months, 3 months of general surgery and 3 months of obs gynae, then it can be considered. Otherwise, there have been some difficulties about ophthalmology. Somebody have written ophthalmology and somebody have written
Yeah.
eye. Somebody have written otorhinolaryngology or somebody have written IENT.
Yeah.
So these are minor issues, and it can be dealt. It can be dealt like via direct email to IMC, the registration body department. So you just
Mhm.
email directly to them, and I would always recommend, please talk to IMC directly rather than taking. You gather information from other people as well, but always double check with official forum.
Okay, thank you so much. And Dr. Mozam, there is a most frequently asked query, like because some of the times there are doctors whose spouse are also here in Ireland and they want to work in a hospital. So they are asking for any of the jobs which they can done without IMC registration.
Without IMC registration, to be honest, I don't think so. There's
Yeah.
anything like if you have to work in Ireland, you have to have IMC. Um,
And what would you like to say about
it's,
observership?
it's very difficult in Ireland, this pathway.
Okay.
Like in UK, it's very easy. You contacted. I have
Yeah,
also done
yeah.
electives in Glasgow
Mm-hmm.
myself back in 2012. In
Okay.
Ireland, it's very very difficult because if you have a visa in Ireland, then you still need to contact IMC and that particular department. Or if you are Irish or a EU national already, if you have a passport,
Yeah.
then maybe it's easy for you. But if you're a Pakistani national and you don't have a visa, I don't think so. There's much information available on that because it's not practical at the moment here.
Yeah. Okay, and you were telling us about that there are three routes for registration. So I would like to request you to say some of the words on specialist registration. That what is the requirement and what is the eligibility criteria for Pakistani doctors in it?
Yeah. So specialist registration is for consultants. So before
Okay.
consult to become a consultant in Ireland, there are now there are three pathways. I would say two major pathways.
Mm-hmm.
One is you join their own training program, and their training program has two major categories. One is basic specialty training, which there when their doctors finish their house job, which is called internship here. When they finish their internship here, they start work as senior house officer after their house job for 2 years in a training program which is called basic specialty training.
Okay.
During that, they have to do their membership exam as well to complete to get the certificate of BST and to do all the mandatory workshops, which includes ethics, leadership, communication, professionalism. In PEDS, it contains child protection. In surgery, it
Mm-hmm.
contains a lot of procedural workshops. So you have to do all those. In emergency, it has three years of course core training. But most of it in other specialties 2 years. After completing that, you apply again into which is called higher specialty training. Then you work as a registrar, or we call SPR, specialist registrar.
Mm-hmm.
So most of the programs it is 4 years or 5 years. Some program it is 6 years. So then after finishing that, uh, for some specialty, only few of specialties there an exact exam, like in emergency medicine there's FRCAM, they have to do that as well. But in peds or medicine obs gynae, there's no exact exam. You
Okay.
already have done membership while you are doing PST, and you just have to sit an interview to get HSC. You follow your registration, you complete your portfolio, your consultant you sign off you if they're happy with you, and yeah, once you complete your duration you can work as consultant here. And then if you're already on a training program, then when the college knows that you have completed your training, they will already put you on specialist training. They will send application
Mm-hmm.
to IMC. If the second pathway is you don't enter into a formal training program of the college, but you work as a standalone doctor, and you complete all the membership exam, then you complete all those mandatory workshops of
Mm-hmm.
BST as well as HST. Then you ask medical council, please send me an application pack for alternative pathway. For example, I would talk about pediatrics. When I was doing my alternate pathway,
Yeah.
I wrote and that I'm pursuing alternate pathway to become a specialist, pediatric specialist in Ireland. So IMC would send you an application pack. You have to fill all those form, and for each rotation, and there are different type of forms: clinical handover forms, research form, audits form, ward round forms. Like you have done ward round, so you have to fill that out and sign it from your consultant. So it's become like this much bundle of
Yeah.
paper.
Yeah. Yeah.
So you fill out all those forms and then you submit that application to IMC. With
Okay.
the with the application fee, I think it's 4,000 something like that. And then IMC send that application to relevant college. Like in pediatrics, it would send to Faculty of Pediatrics in RCPI, Royal College of
Mm-hmm.
Physicians of Ireland. And for surgery, it will send to RCSI. Okay.
Okay.
Then their consultants there will assess your application and they will reply to IMC, yes, we are happy. Or if they require some more documentation, they will contact you. Then you send them. And once they are happy, then IMC will put you on specialist registration.
Okay. And how long does it take for change of registration from journal to specialist division?
Like once you have submitted, then it can take up from 6 months to 1 year. For,
Okay.
yeah,
So exactly the same time period for a journal registration as well, because it is taking a lot of time these days,
yeah,
around 1 month,
yeah,
like 1 year to 1.5 years.
yeah. Like for some people, it has been they have been lucky, and they could get in 3 to 4 months, but
Okay.
those are very rare. So I would ideally keep 6 months in my mind. Otherwise, I would maybe think that it can go up to 1 year.
Yeah,
If
yeah.
yeah, yeah.
And you were talking about that in pediatrics you have to do 2 years of BST. Is that true? 2 or 3 years?
In pediatrics, in medicine, it's 2 years of PhD. Yeah.
Okay.
In
And it
emergency
varies.
medicine, it's
Yeah.
so
Actually, it is my next question. Like, it varies from department to department, like
yeah,
specialty to specialty. You have to do 2 years or 3 years or 4 years.
yeah. Mostly,
Okay.
it's 2 years of basic specialty. Only in emergency medicine, it's called core specialty training of EM. So C STEM.
Okay.
It's 3 years, and
Okay.
it's advanced is 4 year then. Then in other specialties, like in pediatrics, is 5 years of HST. In emergency
Mm-hmm.
medicine, it is 4 years of ASTEM, advanced specialty training. So
Okay,
ASTEM,
and yeah, and the next question arises here, that is it easy to get HST in Ireland, higher specialist training?
much easier now.
Just because of AIPPS, I would
No,
say.
like yeah, it's because of Dr. Lika and other field
Yeah,
members who have been like working, of all for non-EU doctors.
yeah.
So because previously we were not allowed to apply for BST while on general division. So this was the
Okay.
first hurdle that, and first requirement of HST is BST certificate. So once you don't have a BST certificate, they have stopped giving equivalence BST equivalence certificate from like 7 8 years ago.
Okay.
So there's that is the first and main hurdle, which is now has been overcome. There are
Mm-hmm.
loads of non-EU doctors which are in BST program already, and there are good few doctors from last 2 years who have gained HST. They're non-EU doctors.
Okay.
So it has become easier now, but again, I would still say it's not very easy. You still have to stand out, and your CV should stand out as compared to your other colleagues and competitors. You have done good few audits, or especially an audit with a QA project, uh, and membership exam timely mostly, and
Oh,
membership exam anyway. It's a entrance criteria for HSC interview. Without that,
okay.
you can't apply for that.
Yeah. Okay, thank you, Dr. Mozum. And the next question here is, because a lot of our juniors in Pakistan are applying for different jobs for the last 1 year or the last 2 years. So the most frequently asked question is, they used to ask me like, what should be in our CV? Like how the CV should be structured or tailored to get a job in HSC. What would you say
First of
about it?
all, enter into a training program in Pakistan.
Okay.
People think that, oh, because they want to go out of this country, then
Yeah.
that's why FCPS is not important for them, or it's not for them. I always tell them, all the job recruiters here, all the consultants here, even Irish consultant here, they know about FCPS, because 40% of doctors are non-EU here. Out of those, like majority are Pakistanis. Okay, so they all know about FCPS, and once they two or three people apply, for example, and one person has done an FCPS or already into FCPS, and other person is doing a medical officer job or somewhere,
Yeah.
mm, they will definitely take the one who's done FCPS. Okay, so first, at least enter into any of training program, even MD, MS,
Okay.
any training program. Enter
Yeah.
into that. Do some audits. Please don't do those paid research articles. Okay, and when you tell them that I have published 6 articles, or at least 2 3 articles which are mandatory for central induction in back home,
Mm-hmm.
uh, they're not good. Yeah, it's good if you have done yourself. It's very good,
Yeah.
amazing. But if we know how things work back home, so if it is not done by yourself mostly, then please don't mention it, and just do audits, small audits, QI projects. It's will really, or anything which you have improved, like there was a doctor who just introduced, there used to be paper discharge letter, which is mostly in Pakistan like this, so they
Mm-hmm.
just changed it as a, on the computer, he just told that I changed it from paper to Word document, and we used to then discharge on Word document, and then we used, I remember when I was in CMH, there used to be an Excel sheet of all the patients records,
Mm-hmm.
their diagnoses, their intervention, their complications, blah blah blah. So when I told, they were very happy for about that. So th- even these kind of small improvements, just tell them, and they will be happy with that.
Okay, but there comes a question that a lot of juniors ask, that because in Pakistan we know that there is no concept of audits and quality improvement projects. So the aspirants ask that if anybody is having a CV, there is no audit, no QIP. So would it be easy for him or her to get a job? What do you think? What are the chances of getting a
if
job
it
here?
is if it is I always say it's luck based.
Yes.
These things help you, but I have seen lots of people which have no audit. Even I don't think I had any audit when I got the job. So
Yeah.
it's never lose hope. But if you have one audit, it will definitely increase your percentage or likelihood of getting a job here.
Mm-hmm.
Yeah, but you can
Okay.
still get a job.
Yeah, and as you belong to pediatrics, so what you can advise to your juniors for getting a job in peds? Like, what are the courses and what are the certifications they have to do for getting a job in pediatrics?
First, training program. Second, any small audit. You can do an audit on sepsis guidelines, how it is
Mm-hmm.
being managed in your own unit, timing of antibiotics, when the patient came, when it was prescribed, when the patient got. It's a very quick small audit, and it is very very important. And if you
Mm-hmm.
tell somebody in Ireland that you did an audit on sepsis or antibiotic timings, they would literally go like this, that oh very good, you're doing something. So, and there are a lot of other stuff. This is just few example. You can do even audit on your own hand hygiene, that how I am doing hand
Yeah.
hygiene. There are 5 movements, so loads of things. And then child protection, find an online course on child protection. Mostly they will
Mm-hmm.
be free, and just do something on child protection. If you can do APLS, I would always say do APLS. So
Okay. Okay, thank you so much, Dr. Mozam. And because you are currently on GP scheme in Ireland, so I would like to request you to uh, tell some words about this scheme, because this is also most frequently asked question, and a lot of juniors are in a race of getting GP scheme here in Ireland. So what would you say about it?
Ireland is in a huge shortage of, even across like kind of Canada, Australia. There's huge shortage of GPs. Okay, so and they are increasing the slots mostly every year. 20-25 slots are being increased recently, last year as well. The process starts from application process, which opens up in September. People should need to keep an eye on their official website,
Okay.
icgp.ie. Keep an eye on the website when the application open. Submit an application, then start preparing for the test, which is has two parts: situational judgment test, SJT, and clinical knowledge test, CKT. There are lots of online portals and uh, platforms which you can have, like MCQ banks, which would help you to prepare for that. Just take one of them and just quick, at least do two revisions of those all MCQ banks. uh,
Mm-hmm.
no matter what you take, on examination bank, past test. There's some other website, Irish based websites as well. I don't want to name anyone, so that if I forget other one,
Yeah,
uh,
yeah.
I don't want to give any undue favor to anyone else. Okay, so you just search. There are good few there which are recently been made in last 2 years for Irish test. So
Mm-hmm.
first, just when you have test, just focus on test and forget everything else. Once you're
Okay.
done with the test, then prepare for interview. Even if you have to get a paid interview preparatory course, do that. And ask those who have recently done, especially last year, they have changed the interview pattern. Previously it used to be one interview with two interviewers, like one go interview with two interviewers on Zoom meeting. Now this time they have six different people in different breakout rooms. So you enter into one breakout room on Zoom meeting, and then you interview that, and then you get exit and enter the other one. So, and it's one person asks you a situation, one person asks you a clinical question, one person asks different question. Mostly it's a how to deal with a difficult colleague, how to deal with a difficult patient, how to deal with a difficult boss. So mostly situational judgment is mostly like this. But I would say always prepare for interview. And then the third process will be how to prioritize your preference list, which training program you want to enter. Like there are different counties, there are different divisions. County Donegal has different, Ireland Northeast have different, Ireland Southwest have different. So
Mm-hmm.
like more Dublin ones are most competitive, and mostly if you are Irish national, then I would say yes, you can put Dublin. There are 3 or 4 schemes which are in Dublin, so you can put those schemes in on top. Otherwise, don't put Dublin schemes on top. Otherwise, you'll.
Okay. Like,
So
does your like sequence really matters? If you are putting Dublin at the top and Cork on the second and Limerick on the third, does it really matter, or you are getting allocated according to your merit?
for example, there are like this time there were it was decile center. Previously, it was merit based. You were on numbers. Like this time, it was decile based. So it was 300 some candidates, and they divided into 10 deciles.
Mm-hmm.
And so one group had 30-35 doctors. The first decile was the lowest merit, and 10th decile was highest merit For example, if somebody who's in fourth decile, who's near in the middle, and
Mm-hmm.
they don't have an Irish passport, they are not Irish national, even if they have stamp 4, uh, because most of the the preference from preference list on the college has, they have to allocate Irish nationals first, what
Okay.
their preference is. So first all the Irish nationals will be allocated their preference, and most of them will definitely go for Dublin or Cork, or some of them are here, but very rare.
Okay.
If somebody who is on fourth or fifth centile decile and is non-Irish, put three top Dublin schemes on the three, and fourth one Cork or something. What will happen? He was already on fourth decile,
Mm-hmm.
so his merit might go on to his sixth or seventh preference. So it's very
Okay.
complicated, because he
Mm-hmm.
didn't get, if he put one scheme, for example, um Clonmel scheme, or
Yeah.
the Ireland Midwest or scheme or Midland scheme on the top, and he's still in the fourth decile, he still has a
Mm-hmm.
chance, because Midland is not very competitive
Yeah,
scheme.
exactly.
Previously, before this year, Donegal and Kerry was the least competitive schemes,
Mm-hmm.
but this year Donegal was the one of the most competitive schemes as well.
Okay.
So because what happens, it was in the air that if you put Donegal first, you will get it,
Okay.
but everybody knew that.
Yeah.
Everybody put Donegal first, so that's how
Okay.
it changed. So always uh, talk to somebody who's already into scheme, and tell them what is your decile or what is your merit number, and then decide according to that. But if you're not Irish national, just leave Dublin schemes on the side and go for something else.
Okay, and Dr. Mozam, in the beginning of the podcast, I was mentioning some of the achievements of the AIPPS. So, can you please elaborate these achievements? Because I must say that for Stamp 1H holders, it is accomplishment of the AIPPS that we can get PR of Ireland in just 2 years rather than 5 years. So, can you please have a
I
voice
think
on?
Lika is about to join it, I think so.
Yeah, yeah.
Maybe he will be able to tell about those as well. I'll just, before I forget, I wanted to tell everyone that if you are in Pakistan, don't think that you cannot get into GP training. In our hospital, I know one guy who has just graduated like 2 years ago. He was working
Mm-hmm.
in Hyderabad, and he had no previous experience of Ireland or UK or any other country, and he
Mm-hmm.
applied and he got GP training in Ireland while
Okay,
sitting
that's
back home.
amazing. Yeah.
So they can definitely get it. And there is another GP program which is called non-EU rural GP scheme, which is for those doctors who have worked in family medicine
Mm-hmm.
or primary or secondary healthcare set up in Pakistan for 3 years, or even in UAE or any other non-EU country. They have worked in family medicine or primary healthcare for 3 years. If they can give their evidence of those 3 years, they might be able to get into non-EU GP rural scheme. It's a kind of alternate pathway which I was already explaining.
Yeah.
Uh, so then you just work for 2 years here with a GP, and you do your GP exams, which is CKT and CCT, clinical knowledge test, and clinical test, CCT.
Okay.
Then you become a GP specialist in Ireland. So these are two.
Okay. Okay. Thank you so much, Dr. Mozam. And now we are having our another special guest, Dr. Lika Rahman, who's the Vice President of AIPPS. So welcome, Dr. Lika, in today's live show. And I would like you to introduce yourself to our viewers first, and then we will proceed.
Thank you so much. I'm so sorry. Actually, I got some sick patient, so I was on call as well. So it's this thing
It's
is
okay.
going on. So as you mentioned already, Dr. Lika Rahman is my name, and I am president of Irish Society of International Doctors, which is an association that has been involved in all the campaigns for international doctors for the last 6 years. And I'm vice president of Association of Irish Pakistani Physicians and Surgeons, which is a collaborative organization with Irish Society of International Doctors, with all those campaigns that we have done, especially involving the Pakistani community. and I'm also elected medical member of the Irish Medical Council. Recently, last year, I think it is historical achievement for any immigrant doctors that in the history of Irish Medical Council we won the election with a big margin, and I'm the council member of that. And also, I'm consultant pediatrician and have been trained in Ireland through alternate pathway, and this is all my I think description so far.
This is wonderful description, I would say.
Thank you.
So, Dr. Lika, I was mentioning about achievements of AIPPS in the beginning of our show. So, it is amazing achievement. I would say that doctors, like Pakistani doctors here in Ireland, can get PR of Ireland in just 2 years. So, can you say some words about it? How did you achieve this accomplishment, and what were your efforts in this?
Thank you so much. I think that was all the teamwork. Dr. Mosam has been with me
Yeah.
for the last 6 years, and we are few people, including Dr. Mosam and maybe few others, and but rest of the community, we have been engaging through surveys and research, and we are the main leaders for that campaign. So basically, um, if I will give a very brief background of the Irish health system for the international doctors.
Mm-hmm.
So any doctor who comes here is they have been coming on the general permit, and they have been coming on the 4 months, 3 months, or 6 months short contracts. So
Yeah.
it means that they're getting the same visa duration, whatever the contract is, you have to get the same visa duration, and for the family as well. So it means if you are 6 months contract, you're having a 6 months visa, and your family has a 6 months visa, and every 6 months you need to find a new job, and
Yeah.
then you need to find a new contract, new visa, and this vicious cycle keeps on going until you get an Irish passport or stamp for, which usually majority of the doctor gets after 5 6 years staying in Ireland. So it has major implications and adverse effects on the financial, psychological, family, and social well-being of the doctors. These short contracts and visa problems, so you have to pay every time money,
Yeah.
and you
Exactly.
go through, and especially some stressful thing happens when you don't have a job. So it means your visa expired, you have to go back to country. So and you are prone to vulnerable to the bullying as well in the hospitals. So if you have a short contract, if you have no visa, they know already, the employers, they bully you. So I have
Yeah.
been through all this stress, and my other colleagues. So the only thing that we wanted to do is that we need to have a stability in Ireland, family and social. And third thing was that career stability, because we can sacrifice many things, but not on the career. So initially, it used to be the doctor would not be able to apply for a training, and then to get eligibility for training, and then to have equal access for training. These are all the things that were in the past many decades. No one has addressed them, and we wanted to do something that could sort out all those problems. And it was an immigration reform that is linked. Irish laws are linked to nationality and other stuff.
Mm-hmm.
This was, I think, that our historical breakthrough in the history of
Yeah.
Ireland, in the history of Irish international doctors. So especially, it is one of the world's top, or one of the world's best immigration reform for doctors. We introduced new stamps, and especially another thing I want to point out is the spouse of the doctors was not having working rights. So for 5 6 years, if you are a skilled professional, you're a doctor, and your wife is a IT or something, so the stamp they give you, it is non-convertible to any other stamp. So it means 5 6 years until you get an Irish passport, you cannot apply for a job, you cannot have a job. That
Mm-hmm.
was really disturbing thing. So
Exactly.
we wanted to bring an a stamp or immigration reform that could address all these problems, and it was a tiring effort. uh, if we write a book on that, so it will be a like big book, that how we would go and how we exploit our resources and ourselves. So media, politicians, it's very hard to engage Pakistani international community, very hard, because they're busy and they don't have a hope, so they
Yeah.
want to leave. So if they don't find any difficulty, they say, oh, we'll leave it. So it's very difficult task to engage
Mm-hmm.
the community. And alhamdulillah, by the grace of Allah, we did that. We didn't lose hope. And I think 2022 April, we got through, and we did a massive campaigns in the Twitter, massive
Mm-hmm.
campaigns. Irish public supported us, and the bureaucrats, some ministers, and that's way we used, and ultimately we come to that point that we have reforms now. It's not that simple. So it means what Dr. Mosam might have explained already before me. It means that you are being treated completely differently with the immigration. You have a
Mm-hmm.
different stamps, and you have a different identity now in the immigration as a
Exactly.
doctor. And that spouse rights portion, it helped not only doctors, it helped all the skills, like thousands of nurses, IT, because none of them had a working rights. So through
Yeah.
us, it helped everyone, basically thousands of international people who are working in Ireland. So we are very humbled, and the purpose behind that wanted to tell that if you go through some difficulty, you should not ignore it. You should at least raise it. You should at least do something for it instead of being quiet or just move on.
Mm-hmm.
So that was the main purpose behind that. And people, even Dr. Mozam, no, everyone told us, oh, nothing is going to happen. You are wasting time. Go. I got opportunity in New Zealand. I got opportunity in UK. Dr. Mozam might got opportunity somewhere in UK.
Mm-hmm.
We didn't leave because if we leave, if in the middle of these all campaigns, it will be on gone.
Yeah.
So we sacrifice ourselves and our family life, everything for all of the international doctors. They should know the background history. It's not the point that I'm telling that I have done something. It's a point that they need to know that how much commitment, work, patience, pursuance, whatever name you can use for that, we have done for thousands of doctors and their families that which are going to come to Ireland, especially for training purposes. So you can have a equal training access now. Even Dr. Moazzam was saying like you can be in Pakistan and apply for a training. You can never
Mm-hmm.
imagine that few years ago. Can never imagine that you are
Yeah.
in Pakistan and you can apply for training. Not at all. But now you can,
Yeah.
and we can have it. So
No,
thank
I
you.
would
I
like
think that's
to
what I want.
say thanks to both of you and our president as well, Dr. Noman Nabi. Just because of sacrifices and efforts of few people, we are enjoying equal rights in Ireland today, and our upcoming juniors will be enjoying the equal rights. So that's the wonderful thing. So, Dr. Lika, I would like to know about the newly introduced reform that if a doctor has done his FCPS training in the Pakistan, he or she can get entered into the higher specialist training. So I would really like to know about this thing.
May I confirm that? Can you hear me clearly?
Yes, I can hear you.
Can you hear me clearly? There's some interruption in the video, so in the pictures.
I'm
We can hear
I
you.
can.
We can
Yeah,
hear you. Yeah.
we can hear
Go
you.
You
ahead.
can you can hear me clearly.
Yeah.
Your question, I think it was interruption in between half of the question. I couldn't get it. If you can repeat
Okay.
it again.
Yeah. So my question was, I just want to have a knowledge about newly introduced reform that if a doctor has done training in Pakistan, either FCPS or MDMS, he or she can get higher specialist training in Ireland.
Okay, I'll
Yeah.
switch to the.
Yeah, I think his connection is not
Yeah,
stable or something.
Yeah, I think
yeah.
so. This is the
Is it
problem.
stable? Is it stable
Yeah.
now?
Yeah.
Yes.
Yeah, because I switched to my phone now because of the internet. So we are talking about the recognition of prior learning, the question I understood. So basically, that was our first project 6 years ago, that any doctors who is experienced here in this country should have an career progression, because they come to they come from back home where they are trained FCPS, MD, MS, whatever you can name them, and after 10 years experience, they come here and they have to start from the A, back scratch again. So that is not unfair for them. They're overqualified, and we wanted to highlight this issue at the beginning, and that was the start of our all campaigns, that their
Yeah.
experience should be recognized at some stage, that they should be given an opportunity to apply at a higher level, higher training level. I think that kept on pending, everything resolved, but this issue was still there. So a few months ago, they put on a focused group, research group on that, and I was a part of it. I think Dr. Mazhab was also a part of it, and I recorded all of my suggestions that we are losing experienced doctors who work here 5 6 years, but they cannot go back to the SHO or basic training because they're overqualified, they're holding membership exams. They should be given a chance, a fair chance to apply for a higher specialist training. And I think few weeks ago they accepted that, and now any doctor who has structured training, international doctor structured training, holding MRCPI as well and Irish Medical Council registration, they can directly apply to higher specialist training, just like happening in UK, ST3, ST4. You bypass
Mhm.
few years of the training. So in Ireland, you can do the same now. So if you're having a structured training, you're holding IMC and you're holding MRCPI degree, so you can apply for higher specialist training and you can exempt 2 years of basic specialist training. And I think that's a very good for all the international doctors who are doing structured training in back home. They can definitely come straight to the higher specialist training.
Okay, thank you so much. And Dr. Lika, what do you think? Which specialty has the better chance for our juniors to get a job here in Ireland, just for the standalone job?
Thank you. This is the most common question. Even
Yeah.
yesterday, like many people asked me, and you always find out some techniques to get a job in Ireland. I can tell you, almost 29,000 doctors are registered with IMC, and 23,000 doctors paid registration this year. It means 23,000 doctors are looking for a job, and the vacancies are like 6,000, half in the training, 3 4,000, and 3 4,000 around in a non-training post. And you can imagine that 4 times the number of the registrant as compared to the one who are working in the system. And out of that, only 20 to 30% people, they leave every year to other countries. And now the international doctors, they stop leaving, and they used to
Mhm.
leave to UK before. Now they stop leaving. They wanted to have some career in Ireland because they have some hope and fair opportunities. But the Irish
Mhm.
doctors, 20 to 30% still they leave to New Zealand, Australia, and that vacancy is being, matlab, that gap is that you need to fill by 23,000 doctors who are surplus. So you need to find out a different way and techniques how you can secure a job in Ireland, because Egypt, Sudan, Pakistan, other countries, that at the same time, all of them applying for a job. So I usually don't disclose the techniques, because if I tell them now, so everyone will be jumping, and this is what happens. So I usually, anyone who is desperate or contact me privately, I tell them like this is the way to go and this is the way. But in general,
Mhm.
I'm telling you, the specialties which you should focus on if you are doing a house job at this level in Ireland. There's always some room for emergency medicine, general
Mhm.
medicine, psychiatry, and apart from that, I think these are the three major.
Okay.
And apart from that, pediatrics, peds have chance, yeah. But the main thing in that, I think Dr. Mozam will second me, is that what level you should apply.
Mhm.
So saturation is there at a SHO level, because
Yeah.
everyone wants to be SHO, even their interns, the any doctor who's coming from outside, their own doctors, they want to be at SHO level first. So that's where the saturation is there. So that's one technique that you should apply for a registered job if you feel like you have done a training and you're competent enough. And there is a understanding, so psychological understanding, that you need to think about that the what system exists here and what system exists back home where you have been working. So
Yeah.
in our countries, it is a completely opposite system. People think if they're doing a registrar job over there, it will be as busy or as less supported there, but not here. If you are a registrar, you have a consultant that is taking the CN or whatever, so you have to make a communication between junior and consultant. So they need to understand the approach, and that's where the fear factor, that if we go for a registrar, what we will do. So they need to understand
Yeah.
first, so they can easily grip that. So that's where you need to target the jobs. And for example, if I give you an example, someone is working in respiratory medicine,
Yeah.
have done training in FCPS in medicine, and now, or maybe respiratory medicine, So they can have their CV be made in a way that they can target general medicine, they can target respiratory medicine, even they can target the emergency medicine as well. So, but the people need to know. On Dr. Muslim was telling us in a few half an hour ago, a while ago, about the family medicine consultant, non-issue rural GP. If you do a survey, you will be surprised. Like most of the doctors don't know about that. So you have done a training in medicine or maybe family medicine, and you're looking for a job for many years, and you don't know there's an opportunity exists in a form of non-European rural GP program, and that's kind of training program, proper supervised program as well. So definitely you need a guidance, and you need a different techniques to hunt the job. And these techniques, I think that I will say that generally you need to find through the agencies and the portals, and you need to apply as soon as possible once it is advertised, because most of
Okay.
the cases what happens, so they take first 50 or 100 CVs,
Mm-hmm.
whoever applies first, they take it. Even if this is happening in UK, and I know it is true because I have been through it as well. So because they are not concerned, two vacancies like 1,000 applicants, how they're gonna do that? Either someone give the CV to reference, or
Mm-hmm.
first 50 CVs that they will take and they will start. So there are some techniques which I don't think so I should be telling here, because
Yeah,
so
I can
23,000
understand.
people, so your technique is gone. So, but generally, I'm telling you that you need to look after how to hunt the job, and you need to find out some ways for that. I
Okay.
hope this is
Uh,
addressed.
yeah, thank you so much, Dr. Lika. One last question for both of you. Like, how much recruitment agencies are helpful in getting you a job in HSC?
I think I'll leave to Dr. Muazzam. I think he will be the best person to answer.
Not very helpful, but there are some situations which they are like it. The first thing, as Lika said, that apply as soon as possible. The job is advertised. The second thing is, uh, yeah, the other, if if things can stand out, the recruitment, they definitely can help, especially if their job has been advertised lately, or somebody have left the job and
Mm-hmm.
hospital is not able to recruit for them, or especially the GP, private GPs. Sometimes they are recruiting through the recruitment agents, but always knock all the doors. So
Yeah.
all contact the private recruiters as well.
So, Dr. Mosam has addressed this question very well. I'll add few points. Um, the recruitment agencies, they are leftover basically. Most of the cases, the jobs were leftover, not able to be filled. So they always, most of the time, they mention that we need a person who is available here. And in the background, recruitment agencies, they take money from the hospitals. So whatever job you secure, so they take some percentage, maybe 15-20% of the total income of the person is being hired. So that's why HRs or the employers, they prefer that someone tries themselves first until they have a backdoor connections with agencies. And most of the time, the agencies in the rural area, more remote areas like
Mm-hmm.
Kerry, Letterkenny, where no one wants to go from Ireland, and some reputation is not great by different departments. So that's where recruitment agencies are left over, and or some backdoor connections or any jobs who are not filled yet. So I has been recruited myself through some recruitment agency 2016, and
Okay.
myself and many people come through recruitment agencies as well. But recruitment agencies, they literally put you somewhere in very far area, or the jobs which the department which have a very bad reputation, no one wants to go, so they are left over for
Okay.
the recruitment agencies. And one more thing, that if one candidate is applying through recruitment agency and one is applying independently through the portal, so the
Mm-hmm.
employers prefer the one who is applying independently, because they don't have to pay to recruiters, the percentage.
Yeah.
So but they have a connections, um, definitely. So because, and GPs and private, so definitely, so they come through recruitment agencies.
Okay, so before ending the show, I'm having some live queries and I would like both of you to answer them. So there is a question by Mubarak Ali, and he's asking, can you explain about MRCPCH? So I would like to invite Dr. Mozam for this question because I think it is relevant to him. So if you can say some words on MRCPCH.
Both of us actually have done MRCPCH, so it's
Oh,
equally.
I'm sorry. I'm sorry.
But I would say it needs another whole podcast on it. So
Exactly, because it is a very long discussion.
it is a very long discussion. Do online MCQs as much as possible. Do theory exams, and for clinical exam, do preparatory course. It's a must do. Okay, so that's a short question answer.
Okay, and another question is how to get a house job in Ireland. So, Dr. Lika, if you can say some words on this route, like how any like a doctor who has done his MBBS in Pakistan or any other country, how he or she can get a house job here in Ireland.
I think that is a very tricky question. There's no right and wrong answer for that. So,
Yeah.
as far as I know, there are 12 programs, colleges that are running their candidates. So, nine are in the Ireland and 12, three are from the Indonesia or Malaysia overseas. So, international doctors, majority who come into internship usually come from that who are already have their affiliation in Ireland, just like Malaysia or Indonesian colleges. So, rest from outside. I don't think so. There is any fair chance if Dr. Mozam can verify it, but I haven't seen someone coming from Pakistan for internship. I don't think so. That's because the seats are very limited and their own
Mhm.
candidates. So they fill it. So it's very hard. Even their own Irish, they go to European countries, different European countries, to go over there and to have their qualification, and they apply for internship here as well. So it is near to impossible for non-European countries
Mhm.
to apply for that.
Okay,
I
and I think there is one last question. Will doing MRCP exam will help to get a SHO job?
Any exam would help any job. Simple as that.
Yeah, that's a very simple answer.
The more you
I
work,
say,
the better.
yeah,
Hard work will pay.
Yeah.
exactly. Exactly, Dr. Mozam is right. So before you're doing anything, it's very simple just to see what is the worth of that course qualification in the country, native country where you are going to go for a job. So you need
Mm-hmm.
to see what worth this exam has here and what their own trainees and candidate do at what level. So MRCP exam is the kind of entry exam into the higher specialist training. But we think in Pakistan, MRCPA is like a professor and a consultant type exam. So we have a
Exactly.
different, perspective of that approach. That if you have done MRCPA, so they will say, come on, we'll take you. You are like very higher level. But here, when the basic trainees, they do the training 2 years after internship. So the to get the certificate of basic training, that's a requirement that you need to complete MRCPA exam, and this opens the door to go for a higher qualification. So that's where the main theme. So if you do it, so it means you have additional qualification and which is internationally recognized, and this is good on your CV. So as compared to the other candidates, so that's it. I think I could say for.
Okay. Okay, thank you so much, Dr. Mozam and Dr. Dika, for your precious time today. And I'm more thankful to both of you for being a part of this podcast. If you have any message for our juniors, please say
No, I think the whole podcast was a message. So
it.
keep applying. Don't lose hope. Your time will come. Many of us had to wait more than 2 years
Exactly.
after getting registration and getting a job. So
My message is that same as was my second, that when I was in 2016, even in 2016, like maybe out of 10, 9 people made me hopeless and disappointed. There's no job in Ireland, saturated, no house
Mm-hmm.
job, no internship, this and that. That should not be happening. I'm talking about specifically in my own country. Not sure about the other countries. So people will despair you and bring you hopelessness, but you need to do effort. You need to do the checks. What you have, what is the requirement here? Fulfill that. Do some effort, and rest leave to Almighty. If your provision and risk is here, you will definitely come here. But in your hand is hard work and effort. That's it. Hopelessness is should not be the case in any way. So now at least one thing that I want to mention, maybe
Yes.
relevant, we also target one area. We targeted many areas for our international doctors. We also target that I think we didn't discuss. It was a locum reforms that we did. So locum reform mean that we wanted to create more regular job opportunities for those who want to come into this country, because definitely if someone is getting permanent residency, before the people used to leave UK, now they're not leaving, they're staying here. So it means they are blocking the way for the others who wants to come. So we introduced locum reforms. It means you have a very good after permanent residency, you have a very good opportunity to earn and to have some family life through doing locums and not doing regular job. And this has created more regular jobs for the international doctors to come here. So that was another project that we did it, and we are very proud of it. And a lot of who are on maternity leave and cannot do the regular jobs and they're living for a long time. So this is a very good for them to have a locum, reforms and better pay and all other stuff.
Okay, thank you so much to both of you for being a part of this live show. And thank you, our viewers, for being a participant. I hope that a lot of queries have been answered by both of our respected guests. And if you guys still have any queries, you can contact me. You can contact Dr. Mozam, Dr. Rika. We all are here to help you, being a part of MedExam and being a part of AIPPS. Thank you so much. Allah Hafiz.
Thank you. Thanks so much.